Good afternoon. My name is Tiara Young. I am currently a Herzing University student, and this is for course 673, Psychiatric Mental Health Care. Today, we will be talking about substance use, and more specifically, we'll be talking about the use of cannabis, which is very widely known, and the prevalence of such has severely integrated our community and human race, especially here in the United States. Concentration of cannabis use with the majority of a good chunk of the clients that we will see or face in our practices definitely has an impact on the mental health stability. So let's dig in. Cannabis, as we see here on slide 1, is a mixture of dried leaves, stems, flowers, essentially can be categorized as a herbal element. One of the main ingredients is THC, also known as tetrahydrocannabinol, which is intoxicating and a mind-altering property. As a result, this changes a person's behavior, moods, and thoughts, though there are some arguments in society that state that there can be some medicinal benefit when used in certain ways. The substance, despite having the intoxicating properties, has been identified to be applicable for patients both mentally and physically. Even in some cases, it's being marketed as something that can be used for medicinal use versus just substance abuse. And this comes in different forms. Clients have purchased it in the use of a pen, gummies, or different foods or edibles, loose leaf form, and even candy. The different forms of distribution create a different variety of effects. So this is something that if a patient is engaging in, we would want to explore further with them. The level of abuse that we see with patients has certainly increased. And some of the ways that the DSM-5 helps us to break down the criteria of whether or not this is considered substance abuse or cannabis use disorder would include if they're using a larger amount for longer periods of time than what is originally purposed or otherwise known as recreational, if they have a constant desire or inability to reduce or stop using it, extended recovery times, use of it even when it's causing a disrupt in the person's everyday environment, tolerance of the drug is very high, thereby requiring higher doses in order to achieve the desired effect. And if they choose to stop, they're experiencing withdrawal symptoms. And this can factor into their sleep hygiene, anxiety, different coping mechanisms or inability of various coping skills, and also a hyperparanoia that patients may experience. Back again to the prevalence and the epidemiology in the United States, according to the CDC, we have over 52.5 million or 19% of Americans who used it at least once in the last few years. And unfortunately, these statistics continue to rise and are even higher than the stated amount here in our adult, but also youth and elderly population. The effects are detrimental not only to the individual who's taking it in, but keeping in mind, just like with nicotine, secondhand bystanders also can experience side effects that are unfavorable. This is especially true for those developing their brains, such as children, or around individuals who have challenges already with memory, attention, reaction time, awareness factors, once again, paranoia or emotion. Approximately 3 out of 10 people who use this drug, cannabis, do have cannabis use disorder. So we definitely want to make sure we're screening thoroughly for that. As far as risk factors are concerned, there's actually an increasing development within youth. And so early prevention and intervention is obviously very helpful to prevent this habit from developing at all. One of the sad components is that brain health is very much impacted when a person makes this a regular habit. Additionally, it can cause a person to lose as much as 8 points off their IQ when they start at a young age. And even later in life, if that's when they choose to start, it still can make matters worse than they were before any use at all. Keeping in mind that some of the most highly reported mental health challenges are depression, anxiety. Cannabis does not help those. In most cases, it actually makes it worse. So that's something that we also want to keep in mind. As far as short-term and long-term effects, some do not recognize that marijuana or cannabis is addictive, but in fact research shows that it is. And the younger that one begins using it, the more likely they will become addicted to that drug. So that's something that we want to keep in mind. Long-term use is associated with the need to continue to consume a greater quantity over time than what one originally started with at the beginning of their practice. So they may feel like, oh, if I don't use this drug daily, I'm not addicted. But in reality, there's other indicators that we look at to determine if this is true or not. Signs and symptoms of abuse may include increased heart rate, delusions, nausea, vomiting, anxiety, panic, confusion, and again, paranoia, just a hyper awareness of things that are going on, or even seeing or hearing things that are not present. Also, there may be some changes in their appetite, sleep patterns, cognitive ability, personal hygiene declining, and grooming. For men, chronic use can also result in reduced sperm count and concentration. As far as overdose is concerned, the word overdose isn't commonly used when it comes to cannabis use. However, it's important to note that it does take several days for the half-life of cannabis to wear off. So to fully regain normal functioning, evidence-based practice actually shows that for it to clear their system, it can take upwards of 4 weeks. And depending on how fast they metabolize it, give or take, for it to completely clear their system. And if their family or genetically they are predisposed to such addictive factors, this can also weigh in on a person's use and receptiveness to what they're using and how quickly they're able to wean off of that. As far as care plans are concerned, obviously we want to be able to treat our patients with the greatest of care and provide the most optimal treatment procedure or treatment plan that we can offer them. So first, of course, we want to assess the patient for use, identifying any resulting problems that are coming from use, and possibly can also do a standard physical to see if there's any other related or non-related health conditions. A family history would be beneficial as well. But when assessing the patient, we want to do both mental and physical and evaluate the patient's acknowledgement of a problem and whether or not there's actually a willingness to get adequate help, because there's levels to that, right? Some may be willing for mild support, but not adequate help to actually cease the habit. Next steps might include educating and advising the patient about the risk and versus what they may perceive as the stated benefits of cannabis use, and alternative ways to create coping mechanisms that they may have been using the cannabis for, but would be better appropriated for them with less negative side effects. It's also a great time to clarify if there's any misperceptions or social misguidance that could ultimately be contributing to other comorbidities that they're experiencing. Lastly, we can refer to any other support colleagues or support clinicians that can assist with things that the patient may be experiencing. For example, if they're experiencing pain and using cannabis to offset, perhaps we can send them to a neurologist or send them to a pain consultant, someone who would actually be able to address that problem more direct and not necessarily by use of cannabis. And of course, educating the family and children on the necessary information also can create a nice support system for the individuals so that they have needed support outside of the clinical space. Alternatively, patients can also attend to their mental health needs. So having a lifestyle that addresses any depressive symptoms, anxiety, having a therapist who can help them to remain accountable, and setting goals and expectations and outcomes, SMART goals, if you will, with a time frame on it can also be beneficial if the patient is willing. Creating a regimen that involves planning an alternative regimen or schedule that promotes a cessation of smoking. So for some patients or clients, we may, in interviewing them, discover that they tend to be triggered for certain things, or by certain environments or by certain stressors, which then prompt them to smoke. So helping them come up with alternative plans and regimens for these triggering matters would also be beneficial in their success. And when appropriate, we can refer the patient to support groups such as Smart Recovery or any other addictive services that may be out there. For pharmacological interventions, there's several that we can use. Some are listed here on the slide to assist, though at the end of the day, the patient still has to do the work themselves. But studies have proven that some of the drugs listed here do assist with reducing cravings, such as fluoxetine, entacapone, buspirone, and lithium, though further studies are warranted. And while it may reduce withdrawal symptoms, it's not guaranteed to completely eradicate all of them. So we want to be upfront and transparent with our clients when discussing some of these alternatives. Naltrexone and N-acetylcysteine has also been considered helpful in reducing the use of cannabis and the success of someone breaking free of the habit. So there are some natural herbal supplements that may also be beneficial in the journey. That brings us to the non-pharmacological treatment, which includes things like outpatient therapy, as we discussed, having a mental health therapist, taking advantage of proper supplements that can be beneficial for reducing cravings, stepping into support groups that are appropriate, either locally or virtual, and when necessary, be willing to admit or do an inpatient recovery at a rehabilitation or detox center. For education, it's important to let them know that if they do intend to continue to use cannabis, driving or operating heavy machinery is not advisable. And if they currently have a subsidiary mental health disorder, using cannabis, especially when the other may not be fully treated, can exacerbate or worsen some of the already resting symptoms. Marijuana or cannabis does not eliminate health problems. Actually, in most cases, it contributes to worsening them or creating new ones. It's also important to note that brain function can be stunted, delayed, or reduced, and it takes weeks, upwards of a month, for brain cells and other intracellular spaces in the body to return to optimal state and go through a complete withdrawal from the drug. Additionally, skin discoloration can occur, such as in nails, color, tone of skin, lip color, etc. Some of the specialties that we may bring in to consult with the client for success would be a PCP or primary care provider, substance abuse specialist. There's also community resources we can inform and educate the patient on. And if comorbidities are present, any specialist that focus on those particular comorbidities would also be helpful. So in conclusion, research shows that on average, many of the offsets of cannabis use are negative. And while there may be some positives that can be supported by the perceptions of most clients who use cannabis, in most cases, the negative effects outweigh any positive benefit. And for the few things that they are trying to seek to create positive, we have alternative ways to treat that would potentially be more effective for them. Ultimately, it's advised that quitting is the best option. Thank you for your time. There's the references here that were used to support some of the data and the information in the presentation this evening, and I look forward to reading and learning more about this particular topic in our mental health environment. Thank you.